Urinary incontinence is an involuntary leakage of urine from the bladder. In other words, you do not realize it and your urine tends to just leak out. The common type is, first, stress urinary incontinence or SUI. When you cough, when you sneeze, when you carry something heavy that's increased in intra-abdominal pressure, you tend to leak urine. Secondly is urgency urinary incontinence, UUI. So when UUI happens, you are rushing to the toilet, you could not get to the toilet on time, unfortunately you wet yourself. Thirdly is a mixture of the two, or also known as mixed urinary incontinence, where a person has stress and also urgency urinary incontinence. Next, we also have overflow incontinence. Overflow incontinence is common in men who have enlarged prostate gland and also in those who do not have the sensation that their bladder is filling up. Because that the bladder has filled up to the maximum, the urine tends to find its way out from the body by leaking and producing urinary incontinence. In other instances where you have patients who have stroke, bedridden, elderly, or those who have problem with mobility, for example, they are on a wheelchair or they have problem with their knees, they might have something that we call functional urinary incontinence. In this patient, they are unable to get to the toilet on time because of the restriction that they have. Unfortunately, ladies tend to get UI more common than men. This is because ladies were to go for pregnancy, delivery, menopause, and because of this, the muscle that holds on to the bladder, which is lower down in the pelvis, weaken over time. Therefore, they tend to leak urine more easily. Aside from that, if you have poorly controlled diabetes, chronic smoking, constipation, you can also suffer from urinary incontinence. Someone asked me about caffeine in drinks. Caffeinated drinks such as coffee, tea, either green tea, Chinese tea, this has caffeine. Caffeine overstimulates the bladder, causing urgency, and if you are prone of urgency urinary incontinence, you might suffer more if you were to drink high amount of caffeinated drink. First and foremost, the doctor will need to identify which type of urinary incontinence are you suffering from. This is because different types of urinary incontinence have different ways of management. In a nutshell, the doctor will start off with a non-surgical treatment followed by a surgical treatment. Non-surgical treatment will include modification of lifestyle and also medication. They might also encourage you to do certain types of exercise to reduce your urinary incontinence. If all this fails, only then the doctor will advise you to go for surgery. The best way is to lose weight, and for those, you can start doing Kegel exercise to enhance the strength of your pelvic floor. And if you're a chronic smoker, you might want to decide to quit smoking. And if you have been drinking too much coffee, you might want to reduce your coffee intake in order for you to be able to control your urinary incontinence.